So 6 is a good number.
Okay. All right. So imagine somebody you love needing an ambulance. They're at home. They're having a medical emergency. They need help. Who do you call? 911. Emergency medical services has been the backbone of public safety for dozens of years and acts as a safety net for the healthcare system. Yet, our clinicians and providers aren't necessarily recognized as real healthcare providers by CMS, the Center for Medicare and Medicaid Services. So, paramedics must be included as covered Medicare providers to ensure fair compensation, reduce patient financial strain, and improve health equity and equitable access to healthcare services across the United States. This issue affects us all. Whether you live in a city, you're in a rural area, at some point, you're going to need healthcare services. So as someone who has worked as a coordinator in the billing and reimbursement side, and as somebody who has been a healthcare provider for several years, I've seen how this impacts emergency medical services, paramedics, and our community. So today I'll outline the problem, which is paramedics not being covered, and how we can solve that. So paramedics deliver advanced life support. They do a whole lot more than people think they do. They can do EKGs, they can do medicines, they can do IVs, they can do IOs, which go in your bone. They can do things from help with a cough, sore throat, falls, all the way up to people who are in cardiac arrest and need advanced life support. However, Medicare only covers transport to the hospital. Medicare only covers transport services. So paramedics are not paid for their time, they're not paid for their skill, and they're not paid as a healthcare provider. All of these things lead to us incentivizing transport to the hospital. So we only get paid when the wheels move, which only leads to us encouraging transport of people who really don't need to go to the hospital. So by including paramedics as a qualified healthcare professional and ensuring that they can be reimbursed by Medicare, that will lead other health insurance companies to also recognize paramedics as healthcare providers and reimburse their time and their skill as a healthcare professional, not just transporting somebody to the hospital. So, how do we do this? Medicare sets policy for Medicare services. However, other healthcare companies follow the lead of CMS as the one to take the lead from and stuff what they will cover. So Congress has to pass new laws and new rules to broaden who is covered as a healthcare provider. Currently, therapists, pharmacists, physicians, mid-level providers like nurse practitioners and physician assistants are those who are covered. Those are the only people who can be reimbursed for providing care. Right now, if a paramedic goes to your house for somebody that's experiencing a diabetic issue, they can put an IV in, they can give them some dextrose, they can get their blood sugar up to a reasonable level, but in order for them to be reimbursed for their time, they have to take them to the hospital. Otherwise, we've spent hundreds, maybe even $1,000 on supplies, equipment, time, and we have to include our truck time or maintenance on what it costs to run an ambulance, and we don't get any money back for that. So, the National Association of Emergency Medical Technicians reaffirmed that paramedics are the backbone of emergency care in underserved communities. People rely on paramedics to provide that safety net medical care. So for us, it's important that we could be reimbursed so that cities, counties don't have to subsidize all of the cost and don't have to bear the brunt of that. We see hospital systems and private ambulance services across the country that can't afford to operate because they can't be reimbursed for their time and skill. So, states that expanded reimbursement to include paramedics and allowed paramedics to be reimbursed for services saw about a 30% reduction in hospital transport rates, according to the Journal of Emergency Medical Services. So imagine grandma fell, she broke her hip. We stabilize her, we take her to the hospital, we can get reimbursed. But now, because we're only getting paid for transport, we start reducing services. We only run basic life support. We can no longer give pain medication. We can no longer give blood products or other products to help stop with bleeding or clotting because we can't be reimbursed. So by doing reimbursement, by including paramedics as covered healthcare professionals, we can expand healthcare services to vulnerable populations and those who are underserved in our community. Our healthcare system relies on paramedics to provide timely, life-saving care. So recognizing their value as true healthcare providers is only fair to them and the communities that they serve. So according to the National Association of Emergency Medical Technicians, about 70% of ambulance services struggle financially due to insufficient reimbursement. Additionally, rural areas see about a 20% higher rate of emergency transport than urban ones, which just further exacerbate the financial inequalities and inequities. So in conclusion, paramedics do need to be covered as qualified healthcare professionals, and Medicare does need to expand that list to include paramedics as healthcare providers. It's not just logical, it's essential. So we need to do this to address inequities, reduce costs, and strengthen our overall healthcare system. By recognizing paramedics for the critical